And welcome back. So muscles of the posterior thorax, again, we're seeing the back of Buzz here. So the first two muscles on this list are your rhomboids. So we have our rhomboid minor is on the top, rhomboid major is the thicker one on the bottom. So if we take a look at the rhomboid minor, it originates on the spinous processes of your upper thoracic vertebrae and inserts on the medial border of your scapula. We can see that here, it's just a nice little band straight from your spinous processes to your scapula. And it helps to adduct, so kind of pull the scapula towards the midline, and downward rotation. So it's going to make your humerus or think of the glenoid cavity as pointing down. It's going to kind of twist the scapula like this, downward rotation. The rhomboid major originates on the same spinous processes of the upper thoracic vertebrae, inserts also in the medial border, and does downward rotation and adducts the scapula. So these two muscles have the same function, the same action, the same insertion, the same origin. So that makes it easy. Rhomboid minor is the smaller one on top, rhomboid major is the larger one on the bottom. The next one here is the trapezius. Now again, we're just seeing one half of it, the other half would be hiding these other muscles. So the trapezius is a big muscle, so it's gonna have lots of parts to it. So it originates, it's got lots of origins on the occipital bone and the spinous processes of all your thoracic vertebrae right here. So this is kind of the origin here. And then it inserts on the clavicle, and here's your, on the clavicle, which is in front, acromion and spine of your scapula. So it goes all the way kind of out here. So because of all of the fibers going in these different directions, it can do quite a few things. So of the scapula, since it's hooked to all these different regions of the scapula, it elevates, which means bring up. It retracts, which means pull back. Depresses, so it can be pulled up by those fibers, it can be pulled down by those fibers, and it can rotate the scapula again in either of those directions. It elevates the clavicle, so anteriorly, it can lift up the clavicle in the front, and it helps to extend the neck. So if your head is flexed, it can help you pull your head back because it is attached here. Okay. Turn that up a little bit. There we go. So we can see that origin a little bit better. All right, so that's our trapezius. The next group of muscles is called the Erector Spinae. You'll be able to see this a lot better in your textbook and your lab manual. We can only kind of see a little bit of these guys peekabooing through some of those more superficial muscles. But the Erector Spinae is a big group of muscles that are deep to all of those other back muscles. They run right along the spine. And so, I lost my spot, here we go. So they originate iliac crest, vertebrae, and some of the mid ribs, like 3 through 6. And then they also insert on ribs and vertebrae above where they start, because some of them are straps like this. And again, you'll see that better in your pictures of your textbook. But they work all together to do it. They are a major extender of the spine. So if you are bent over, hunched over, they are what's going to help straighten your back. Erector Spinae, they erect your spine. They can also help in lateral flexion, so bending from side to side. Okay. All right, next we have the Levator Scapula. So if you remember, oops, I'm pulling them out of the field of view here. So here's our scalenes. You remember we had our 3 scalenes, part of the neck anatomy. And then this guy right here is our Levator Scapula. So you might think levator, that sounds like elevator. And scapula is the scapula. So you can imagine it elevates the scapula, and that's exactly what it does. So the Levator Scapula originates on the transverse processes of your cervical vertebrae, inserts on the medial border of the scapula, and elevates the scapula. So it's going to help lift your scapula, like shrugging your shoulders. Levator Scapula helps with that action. Here's our infraspinatus, right below the scapular spine. It inserts on the infraspinous fossa, which would be the dent underneath this muscle, inserts on the greater tubercle of the humerus, and helps with lateral rotation. So it's going to kind of help bring your arm back out to anatomical position. And then we have the supraspinatus. Here's your spine. So infraspinatus below the spine, supraspinatus above the spine. It originates in this supraspinous fossa, inserts on the greater tubercle of the humerus, and causes abduction of the humerus. So it's going to be pulling the humerus away from the midline. All right, so those are muscles of the posterior thorax. I will see you next time for muscles of the body wall.